guys, it's a Savvy Business Chick, making sure that you know your purpose and destiny in the marketplace. And yesterday we got cut off while I was talking to you about creating policies and procedures for your home care business. And I gave 3 tips. Hey, thanks for joining. I gave 3 tips, and I just wanted to do a quick follow-up, a quick encore, and maybe some Q&A. Hey Tan, how are you? So yesterday I was talking about, hey Malika, how are you? Yesterday I was talking about creating policies and procedures for your home care business. And the 3 tips that I gave, where part of it got cut off. Hey, good morning again to you, Makeup Diva. I said number 1 is you need policy. Why do you need policies and procedures? Remember, I said if you have a regulated home care, if you're in a regulated state, you have to create them. This is a requirement. You have to create them in order to get licensed. And then B, if you're in a non-regulated state, you want to use these policies and procedures as a form of SOP, standard operating procedures. Just take into account that you don't know that, even if you are a nurse, you don't know the processes for running your home care business. So you need to create these things so you can have systems and processes and workflows in place. B, we said you need to be using the regulations for your state as a guide. And now somebody may say, well, Sean, what if I'm in a non-regulated state? We know those non-regulated states are Iowa, are Michigan, are Massachusetts, are Ohio. Those non-regulated states, you don't have a guide for your state. So you want to look at a neighboring state and pull those regulations and ultimately write those policies so that you can have a better quality agency than those that are around you. 3, this is the one I did not get to. I posted this in my Facebook group last night. The format for how do you need to write your policies. Now, this is what I want to hover over today during this live. The format for writing your policies, and I'm almost at my location. There is a specific format for writing your policies, and I have been reviewing policies from people who are either licensed, they already got their license, or they are wanting to get licensed in the state of Virginia, in New Jersey, in Florida, in Texas, in Mississippi. Those are just a few, right? And I have the ones for Maryland. I am looking at these policies that most of you have bought. Now, this is kind of for the people that's purchasing policies. I'm looking at the policies for people that have bought policies, and some of these policies are not in the proper format. The actual format template is posted in my Facebook group. But let me give you a hint. Since you can't see what it looks like, let me give you a hint. Signal kind of get choppy as soon as I get on my street. So your policy should have a subject line, a subject area. What's the subject? That is the topic of your policy. So let's say, for example, the subject is infection control. Then your policy should have a number. Now, I say wait to number these until you're all finished, especially if you're working on, your whole a group of policies. Then your policy needs to have an effective date. An effective date for when that policy, right? So let's say, for example, if you are, something just fell out my car. Let's say, for example, if you are trying to get, then put November 1 as your effective date. Don't put the date that you're actually... Wi-Fi, guys, sorry. Dropped my son off at school, and then I ran an errand, so I wanted to be on time this morning. So that's what you need to do. I'm gonna see if I can show you my screen. So one second. And while you are still logging in, guys, let me know where you're watching from. Sometimes I need you guys to leave some comments, drop some emojis, because then Instagram will let more people know that we're on. And I know everybody has different time frames. So I'm going to see if I can pull this up. So help a sister out. Hey, Tyreek, how are you? I want to show you guys what this template looks like. I just did that. So let me know what state you're in. Policy and procedures. Where did I just put that? Ohio. Okay. Where did I just put that? Policy and procedures. That's not what I wanted. I just did a last slide, so let me. And so one of the reasons why I really wanted to share this with you guys is because one of my mentees, she's submitting her license application and policy this week, and her husband from 210. I hear that. I'm glad I don't have to. And I almost bought a house in Akakik before I bought my house here. They at Illinois, of course, Makeup Diva. They have been having such a time with completing their policies, and I'm like, I told them the other day, I said, not necessarily this is ridiculous, but they have done so much work with rewriting their policies. And okay, there it is, open recent. They have done so much work for rewriting their policies, and they spent $2,000 on their policies. And I just, like I said, the amount of help I've had to give them with just giving them verbiage, helping them to do what I'm telling you in these 3 steps, parallel it to the regs. They're getting stressed out. But here's what I posted in the group. Quick. Your company name, subject, name of policy, number, effective date. And I forgot to tell you, then underneath you're going to have the policy statement, the purpose. That's not always needed in procedures. Okay? So you guys just got a quick little preview of what I gave to my Facebook group. So you guys are getting over. No, I'm joking. But these policies are, so why do you need this format? So a lot of people who have been buying policies, they sometimes set their policy up flowing, meaning it's all one document, and it's a nonstop. And the only thing that indicates it's a new policy is a maybe like a large subject line that says infection control or something like that. But it really does not, I'm going to try to show you one thing. Let me see one thing. Try to show you. And feel free to ask any questions. But I want to give you guys an example. Give you an example. Hey, thanks for joining. Of something they did. When writing, do we take from others and add our own? You can. If you have like terminology, like I have two, I have my own policies that I actually, you know, share with other agency owners, like, and so let me start over. So if I'm helping to write policies, or if I'm writing your policies, then they're going to be more customized. Not necessarily customized to you, but in a sense, yes, what does your agency do? So if your agency is doing non medical, but they're only going to do, let's say, for example, live ins and companions, then we're only going to make our policies for that. We're not going to make our policies for every aspect of non medical or personal care services. I have my own policies for my medical agency. So, two things. You're not done writing policies after you, if you're in a regulated state, you're not done writing policies after you get approved and get licensed. When you want to apply for Medicaid, you got to write policies for that. Hi, Crystal. How are you today? Uh, when you want to apply for Medicare, you got to write policies for that. So, and even when you go and you reach out to these insurance companies and you want to be credentialed, even like with, let's say, for example, you want to assist people who have, who with workers' comp insurance, they're going to ask you for your policies. So, in a sense, there's no way to avoid it. Hi, that's my wonderful niece. There's no way to avoid it. That's why I'm telling you, even if you're in a non-regulated state, there's no way to avoid it, because you might say, "Oh yeah, I want to help my, whether, let's say, you're non-medical, and here's a little idea: you want to work with workers' comp insurance claims." They're gonna say, "Okay, to be a provider, to go through our credentialing process, send us your policy on boom, 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 boom." Okay, you don't have it. So you can't submit that application until you get those things together. So that's why I said there's no avoiding writing policies. It's no avoiding having this, going through this process. This is, other than my own policies that I have for my non-medical, um, my medical agents, home care agency. I have Medicaid policies. I've helped people write policies to get approved for Medicaid, for Medicaid waivers. I did not do Medicare, so I have a business colleague who does Medicare. She charges for hers, and that price goes directly to her. I would just refer you guys, if you wanted to do Medicare services, you wanted to apply for that, I would refer you to directly to her. Just know that anybody I recommend, I've vetted out, because I feel like you guys are my tribe. I want to protect you from people who may not, um, you know, do you any good. That's why even the people that I've brought on my live, and I'm going to be bringing another young lady on live that's going to talk to you guys about, either week I'm going to have her talk about starting a group home or doing hospice. I'm vetting these people out, guys. I'm making sure they're too legit to quit. You know what I mean? Okay, Tan saying, do they provide a list of what you need in your policies for your regulations? In a way they do, and I'll show you what that looks like. Oh, no problem. So what I was trying to say before I just became so wordy, sorry, I have policies for medical, non-medical, and Medicaid. And I'm going to poll you guys about doing a boot camp for writing policies. This is going to be you and me and us around the USA writing, taking a weekend day, taking a Saturday, and doing a boot camp to write our policies from scratch. Now there is going to be it's going to be a charge. It's going to be like on Zoom, and I will be able to share with you guys some templates, some wording, stuff like that. But other than my policies, I pull policies from here. I have Decision Health. You guys can look them up. This is my manual that they gave me at a conference. I used to go to this conference in Las Vegas every November, and I don't think they have it right now. That conference was so helpful, and it's kind of some of the things that I learned from that conference. I'm going to be implementing into my Facebook group because, like, say for example, it was providers in Las Vegas, or let's just say New Mexico, doing things, and I'm like, oh, snap, I can do that here in Washington D.C. in Maryland because there's nobody doing that. So I went on live in my Facebook group, and I'm going to do a better video because I really couldn't see people's comments when I came on, to really let you guys know. Yeah, maybe I can hold my own conference. That's true. Thank you so much, beautiful. To let you guys know what to expect from that Facebook group. I am, right now we got like 12 people in the group, and I'm very transparent, very honest that I'm fine with that number. It's going to grow, and the people that started right now, man, you guys are going to be rock stars. My mom mentor, I call her, like how you have a second mom. She always says, I'm into quality, not to quantity. So the ones that are in there right now, man, you're going to see some quality out of these home care CEOs. And the price is going up in October. So this is just a special price for September, the beta month. So let me show you what that looks like. Tan, you said, is there a list? So let me show you what that looks like. In a way, they give you a list of, and I'll kind of end right there because I know my daughter's she's with her dad. I have my son, while I'm looking for this, my son is in school, guys, pre-K. My daughter, they didn't have enough space for her for pre-K. So she's home with me until I find a new nanny. So I lost my nanny in the month of, in beginning of August. And sometimes, God does things to just push you in a different direction. And so I need to buckle down and find a new nanny for her, so that she's getting the attention she deserves. Now this one I'm going to show for Virginia just because I'm currently helping a agency owner in Virginia, and this is just a quick reference because I can show you the regs. This is why I said yesterday and today that number 2, you need the regulations to guide you on what policies you are to write. So this one, if you're in Virginia, this is for you. But if you want to know the answer to Tan's questions, do they, meaning your state, provide a list of what you need in your policies for your regulated states? Here you go. So it says written policies here. The organization shall implement written policies and procedures approved by the governing body. Right? All policies and procedures shall be reviewed at least annually, with recommended changes submitted to the governing body. They want you to write a policy on administrative records, admission and discharge, of termination of service criteria, informed consent, advance directives, including do not resuscitate orders, clients' rights, contract services, medication management, if applicable, quality improvement, mandated reporting of abuse, neglect, and exploitation, communicable and reportable diseases, client records, including confidentiality, records retention, including termination of services, supervision of delivery of services. The list goes on. Look, financial policies, personnel policies, and then it ends, and then I think it ends there. I'm almost done. That's how they put it, right? So let's say you've never wrote policies before, and you look at this number 16, handling consumer complaints. You're like, well, how would I write that? First, go with your format, your agency name, your subject. Your subject is handling consumer complaints. I say, hi, Pastor Anna, how are you? I say, write it in the same way that they're saying here. Make it super easy for them to find, your policy name. I tell people, don't make it difficult. If they're calling it supervision and delivery of services, you call it supervision and delivery of services. Now, wait till you get to your operational policies. Okay. My neighbors are sending me a video. Remember the other night, I got off abruptly. My husband was saying there was a bird outside. There's either a stork or a blue heron in our neighborhood, and it's been in my front yard. So my neighbors are like sending me a video. So I got all these notices coming up. Please forgive me for that interruption. So how would you write? First of all, I'm saying keep your titles similar to what they call it on the regulation. Handling consumer complaints, right? Then your effective date, remember I said put it in whatever month that you're going to actually submit your application. Don't be like, oh yeah, this has been effective since January. Well, you ain't been in business that long. So it's the month you submit your application. Then you want their order. I say do it in their order. Did I say that? Did I answer your question right? So this is their order, administrative records. So that's the first policy you should have. Is this in alphabetical order? No. But put it in their order. Have that be your first policy. Right? And that's Virginia, guys. Yes, Tam, please look up your state and then, drop any questions in the Facebook group, okay? How would you write that? Would you research, other, because Tan asked a question, pulling terminology. Would you research other policies on consumer complaints? Well, not necessarily in the way that they wrote it, because, a consumer complaint for Chick-fil-A is not the same as a consumer complaint for, patient care. So if you don't know how to write that, you could potentially write that one really wrong. Let me just give you a pointer for that. Handling consumer complaints. Think about what, in a home care setting, why you would get any kind of complaint. You would get a kind of complaint. What if there was a daughter and she complained about her mom's care because, every time she goes to visit her mom is wet, and your caregiver, doesn't seem to catch it or change her, or she smells. Okay. So, number one, handling consumer complaints. How are you going to receive those complaints? Think about that. Number two, what's the process of how quickly you will respond to those complaints? Number three, what are you going to do if there needs to be an investigation of that complaint? Number four, how would how would that person know that, this is off the top of my head, guys, because I've written these policies like this. How would you know if what if the person's not satisfied with that, with the resolution? Then, lastly, most states have a site. Oh, thank you so much, Tan. Most states have a site where they want you to refer um, the the client to if they have a complaint. Most regulated states have their own complaint um, department, and you could potentially get in trouble if you're not monitoring this well, because if somebody skips over you and they complain, it's just like, imagine yourself at a restaurant and you're like, okay, this waiter is not handling it, let me talk to the manager. Then it's like, oh dag, am I gonna have to eat this check? Am I gonna get, you want to be the one handling the complaint. You don't want it to go to your licensing board, to that authority, because if they come into your office and they see how you managed your complaint, they're going to say, let me see your complaint handling consumer complaint policy. Did you follow steps 1 through 5 like you said? Oh no, we skipped over it because blah blah blah. Well, guess what? Yeah, that can be a fine right there. Regulated states will fine you. They will fine you. And they will fine you every day. So let's say if you're getting money from the state for that client, I've had this happen to two agencies before when I was really working, doing some different kind of consulting. They were Medicaid. They find that they were Medicaid clients, right? And they had a complaint about one thing. That the state came in, did a survey, because they can do that. They license you, and they found that they were compliant with handling the complaint, but they saw that they were out of compliance when it came to their personnel with the person that worked on that. So they said, oh, okay, because you don't have a current copy of her CPR license, and her CNA certificate expires, we're going to fine you $300 per day until it's updated. These policies, especially with the regulated state, are very serious. You got to know them. You got to write them well. That's why they will only approve you if they, thank you so much, Makeup Diva. They will only approve you if they know, if they feel like, okay, this is an acceptable process. This is something we can, if you break your own rule, we will we will fine you because you said you were going to do this according to the regulation, according to your own policy. So lastly, yes, my job are on our butts about staying up to date. Yep. And now you know why. Yeah, because, they can get fined per day. So okay, so imagine we have a policy and procedure boot camp, and Makeup Diva is in Illinois. Tan, I forgot what state you're in. Please forgive me. And we can cover the different. There's some policies that are the same per state. every state is going to ask you for an infection control policy. Every state is going to ask you for a complaint policy. So what does that look like if we did a boot camp? If we did a boot camp, then it's going to look like, okay, let's compare Illinois to Ohio. That's a non-related state. Or let's compare Illinois to Florida. And can we use the same terminology? Yep. Okay. All right. This is how we're going to write it. We write it because we're this is a working session. We come back in 15, 20 minutes. But Las Vegas, thank you, Tam. 15, 20 minutes, 30 minutes if we need to. Guess what? It's complete. Have you ever gone to like a vision board party and you start working on your vision board and then you're like, okay, I'm just going to take it home and finish it out, and then you don't finish it? Well, we want to have some things finished. So the only thing you need to do is maybe have it, edited, have it edited. Ideally, I've always wanted to do this like in a hotel, like with a small group. But I have, mentees all over now. I wanted to like bring people into a hotel, rent out like a big suite, and just have us like, not listening to, like fun music, because we don't want to start dancing. But we need to be working. Everybody brings their laptop, and then I can like go around and just say, okay, which one are you working on? We have everything spread out. We have good snacks, not like greasy snacks, or food like pizza, but like, good things that we can eat and drink so we can stay focused. If we need to have our green tea, our coffee, our Red Bull, whatever, because we're not leaving there until I would say 80% of our policies are written. I mean, just imagine just leaving like an 8-hour session, just knowing, boom. I know, right? That'll be totally awesome. That's my dream. That's my dream, because I've ran into so many people that don't have that done. And even like existing agencies, like 5 years ago, our state in Maryland, they renewed some of the policy, some of the regs, guys. And because I was on the board, advisory board for the Department of Maryland Department of Health, I found out that it was the agencies. It's almost like you are responsible for knowing if there's a change. And so if they got a survey and they didn't update their criminal background policy, they would get dinged. So they can't say, well, I didn't know. Their response was, it's on the website. So I called up a lot of my agency friends and then people that I know, and I'm like, hey, this is what's coming down the pike. You need to renew that. Well, Sean, how do we renew it? Well, I know because I got the blueprint from being in this meeting. So that's why I said I previously worked with other agencies before really getting into my mentorship program. And my first mentor, she really taught me that. She would help other agencies out. She would like loan them money for their payroll, and so I appreciate seeing all that. She was not threatened at all by competition. She really wanted to build, like a network work. I'm trying to say network of other home care agency owners. And she said, this is the way we used to do it. She said, because banks wouldn't give us money. She said we would get together, and if I got a couple of thousand laying around, I would loan someone so $25,000 so they can meet their payroll. And I'm like, wow, that's what I strive to do in the home care CEO program. So I wanted to get to that level where the true members, like, this is how we function. Like, this is a sisterhood and a brotherhood. I gotta say sisterhood because it's mostly women right now. That like, we're like genuinely looking out for each other. I mean, respectfully, we got to put some things in place so we know, okay, so and so ain't paying me back. Yeah, competition. There's a lot of I'm not sure if you guys ever heard of Aventis Healthcare. They're big here in the Washington D.C. area. Man, I had them sending me referrals because I would go build relationships with people. I always built relationships with other agency owners. So when they saw me, they said, "Oh, that's Sean." So I'm always just like I'm resourceful with you guys. I'm always resourceful to to my business colleagues. Um, that's how I had the opportunity to do some corporate training, to work with some of their staff. They shared with me, "Hey, we're having a scheduling problem. You seem to be really good at this, blah, blah, blah." So that's how I work with people. And then I knew my niche. Now, I don't advise you guys to be niche crazy right now. That evolved, but I was not a threat because Adventist Healthcare, they have a big hospital. So if you ever heard of 7 Day Adventist, Adventist Healthcare, they have a big hospital here, and they have a home care side. The director of home care, of their direct home care, um, we would meet regularly for lunch. We would talk about what's working with his business versus what's working with my business. And even when he left there, um, he said, "Oh, Sean, I know somebody that's trying to sell their business. Can you help them out?" So, people come to me, my business colleagues, and I appreciate, that God has blessed me with that when they need help with certain areas that I'm skilled at. So just know that you guys can go on LinkedIn. You can check me out. You can look me up. Um, I, I'm legit. I just found this morning, and it's always amazing every time I find this. And I'm gonna post this separately. Um, you gotta do for that makeup diva. You got to do some market research, meaning you're gonna have to call around, and I could do a separate train on that. Call around and act like you're a client, and that's on both the caregiver nurse side the and on the client side. But let me close with this, guys. I always tell you guys that within um, less than 2 years, my business was generating 3.3 million in revenue. So I was cleaning up in my office because I was trying to find something for one of my mentees, and came across this letter again. So this is the letter I had to send my sorry, like it's like legit. I don't know how this got. That's my maiden name, right? So this is a letter I had to send my loan officer, right? When I was about to buy my first house. And here, I had to write, in 2008, we had a full year of servicing clients, as well as admitting no less than 9 new patients in 2008. This influx of patients resulted in my company's higher gross income of $3.3 million. Although budgeted salaries were set and paid based upon anticipated number, we exceed our expectations, and owners were compensated with bonus payments. At that time, I paid myself $130K because my business was, you can't take out all your money out of your business, right? But remember, I always say started in my basement from 3.3 million. From it took me 6 months to get my license. It took me 9 months to get 9 months to get my Medicaid certification, and in that 9 months, I was managing another company, building my skill building my understanding of the home care industry with my mentor. I was marketing, so I only could market to private clients. I had an agreement with the company I was managing that any new Medicaid clients that I brought in, that I would be able to transfer them over to my company when I got my provider license. And so I'm just, God just blesses me with the saying what to do. but I had to both submit my company tax return and my W-2 to show why I made so much money in a short period of time. And I was making $10 an hour, guys, while I was building my business. So I went from a corporate job making so much money to making $10 an hour because that's the only thing I could do was work on the weekends at a spa. I was a spa manager, and then I managed this company. But because I had to trade some skill for, me starting my business, like basically I got so much training from my mentor and managing this company that I got paid a lower salary. That's back in 2006. So that's my story. This is my letter. Sorry, it's got stains on it. I hope this has been helpful. Love you guys. Have a good day. Bye.